Hi, this is Audra from Sunware. Today we're going to talk about a common condition that confuses doctors and patients alike. Do you experience any of these symptoms? Cravings for sweets and breads? Craving for beer and champagne? Sensitivity to chemicals and perfumes? Loss of short-term memory? Irritability? Mood swings? Dizziness? Bloating? Gas? Constipation or diarrhea? Or alternating back and forth between the two? Different degrees of fatigue, muscle pain, especially in the neck and lower back, irregular or no menstrual cycle, blurred vision, floaters in the eye, burning urination, and ringing in the ears. If you were to complain of these symptoms to a medical doctor practicing traditional Western medicine, he or she may diagnose you with any one of several different conditions, such as CFIDS, chronic fatigue and immune dysfunction syndrome, depression, fibromyositis, MCS, multiple chemical sensitivity, or even PMS. The sheer variety and multitude of symptoms in this case can steer doctors and other practitioners off track. Eventually, you may be sent running from one specialist doctor to another, with each one taking a crack at your problem, but without you getting any real help. What you may actually be suffering from is a condition that nearly everyone has or will have to a moderate to serious degree at some point in their lives, candidiasis, also known as Candida albicans or just Candida. It is one of the most written about microorganisms in the medical journals, yet it is also the one most misunderstood and misdiagnosed. Candida is the medical term used to describe a yeast infection, a yeast overgrowth that is usually found in the intestinal area and other tissues of the body. It is normal to have some yeast and fungus present in these areas, but when yeast suddenly reproduces at an accelerated rate, it becomes a major problem. It is a strong, invasive parasite that attaches itself to the intestinal wall and becomes a permanent resident of your internal organs. While women are especially vulnerable to this condition, men can get it too. The battle against Candida is familiar to many. Some struggle for years with fatigue, weight gain, and recurring infections, only to be told by doctors that it's all in your head. The luckier ones realize the cause behind their symptoms early on, only to be handed endless prescriptions for drugs that eventually aren't enough to fight back. Candida has become increasingly resistant to pharmaceutical antifungal drugs, and so it is more important than ever to turn to natural methods to restore balance to your body. So what are some of the main causes? The story we keep hearing from our clientele is, I took a round of antibiotics for infection, and the next thing I know, I have a horrible yeast infection that I can't get rid of. Prolonged courses of broad-spectrum antibiotic drugs and sulfonamide drugs are the leading culprits. Prescription meds like birth control pills, prednisone, Decadron, or other corticosteroid drugs can also be instigators. If you have had a recurrent history of colds, flu, gastrointestinal and respiratory infections, suspicion of parasites, and food poisoning, you may have Candida. Having undergone an operation will also make you vulnerable. Severe stress and emotional trauma can be huge factors as well as environmental factors like pesticides, herbicides, fungicides, and toxic chemicals. Other causes may include breast implants, vaccinations, or mercury fillings in teeth. Mercury is especially problematic. What about the solution? First of all, if you take antibiotics, get some acidophilus now. Please note that yogurt does not do the job. It has too much milk sugar and can actually cause more harm than good. You should also adjust your diet to avoid sugars, bread, wine, beer, and vinegar. A colon cleanse is a great way to eliminate Candida and E. coli problems in the bowels. Constipation or alternating constipation diarrhea is a sign of an imbalanced colon, especially if you have vacationed abroad. Certain herbs and supplements are especially effective in treating candidiasis. Pound for pound, the best natural fungus and yeast killers are oregano oil, podiarco, calcium caprolate, colloidal silver, garlic, golden seal, olive leaf extract, and virgin coconut oil. But remember to be patient. If you have a bad case, it is going to take time to treat it. This is Audra from Sunware. Be happy, be healthy, and take care of yourself. And remember, if you have a friend or loved one who might benefit from this message, feel free to forward this to them and have them sign up for our newsletter. Thanks!